let me explain few question and answer about gynecology and obstetricals nursing. This question and answer, we are going to focus the antepartum care. The first question here, a nurse is teaching a pregnant client about the role of placenta. The nurse realized further teaching is needed when the client states that the placenta is. So the client saying something wrong about the placenta, so we need to correct. So out of 4 options, which one is the wrong? If I ask you what is placenta? So placenta basically a circular organ in the uterus of pregnant mother, right? So nursing or this as a healthcare provider, we have to know what are the function of placenta. So first option is here. Placenta produce estrogen and progesterone, detoxify some drugs and chemicals. Number 3, exchange the site for food, gases, and waste product. And number 4, produce maternal antibodies. The correct answer is produce maternal antibody. They said. So nurse realized further teaching is needed because placenta does not do this, right? Placenta does not produce antibody. Rational, fetal immunities are transferred through the placenta, but maternal immune system is actually suppressed during the pregnancy to prevent placenta rejection of the fetus, which the mother body consider a foreign body. Thus, placenta is not responsible for production maternal antibodies, which placenta produce estrogen, progesterone, detoxify some drugs, and also chemicals, exchange nutrition to electrolyte. So in this picture, you can see this is the placenta, umbilical cord connected to the fetus. So this is a feto-maternal organ. Feto means fetal, maternal means mother. So the placenta have 2 parts or component. One is fetal part, other is maternal part. And I said umbilical cord, and umbilical cord contain umbilical veins and umbilical arteries. NCLEX board asks how many artery and how many veins? Only 1 veins and 2 arteries. So let me back about the placenta. So fetal part developed from chorionic sac. This is the chorionic sac, this one. And maternal part, this one, derived from endometrium of the uterus. So let me go back. So what are the normal function of placenta? So normal function, they protect the baby, protection, they provide nutrition, helps in respirations, or helps to excretion, hormone product as well, estrogen, progesterone, but does not produce maternal antibodies. Next question go. Here, a nurse is developing a care plan for a client in her 34 weeks of gestation who's experiencing the premature labor. non-pharmacological intervention should the nurse plan include the half premature labor. So number one, encourage ambulation. Number two, serving a nutritious diet. Number three, promoting adequate hydration. And number four, performing nipple stimulations. Correct answer is promote adequate hydration, right? So 34 weeks of gestation, who is experiencing premature labor. So premature labor, sometimes we call preterm birth or premature birth. So childbirth that occur before 37 weeks of gestation, we call preterm. So the normal pregnancy lasts for 40 weeks, and there could be no reason, or in some cases that the mother's medical condition occur result in early delivery. And as I told you, if the delivery of the baby before 37 weeks of pregnancy, we call preterm. So preterm baby, mother or baby, we need some extra care. We call, what are the nursing diagnosis and care for preterm labor? So we need knowledge deficit that related to recognized of preterm labor. Number two, risks for maternal and risks for fetal injury related to preterm, anxiety related to preterm birth and family consequence, impaired mobilities related to prescribed bed rest, and also anticipatory related to preterm labor and birth. So preterm labor basically occur when regular contraction result in the opening of your cervix after week 20, but before week 37 weeks of pregnancies. And preterm labor can result in premature birth. The early premature birth happens, the greater the health risks for your baby. Many preterm babies need a special care in the neonate intensive care unit. And right, so what are the rationale? Providing adequate hydration to the women in preterm labor may help the altered contractions. The client should be placed in bed rest so that the fetus less pressure on the cervix. The nutritious diet is important in pregnancy, but it does not alter the premature labor. Nipple stimulation activities the release of oxytocin, which promote the uterine contractions. So here a picture we can see, in case of preterm baby, baby size should be normal. Sorry, should be small. Next question here, a nurse is assessing a client who is 6 weeks pregnant. Which findings the best support a suspicious of ectopic pregnancies? So what is ectopic pregnancy? Sometimes it is called extrauterine pregnancy, so-called tubal pregnancy as well. So number one, amenorrhea and fullness of the surrounding structure or tenderness. nausea, vomiting, slight uterine enlargement. Number 3, grapefruit size, uterus or enlarged and also vaginal spotted. Number 4, amenorrhea, sudden weight gain or audible fetal heart tones above the symphysis pubis. The correct answer said amenorrhea and nearby structure, adjacent structure, fullness and tenderness. Best support to suspect ectopic pregnancies. The rationale said the sign and symptom of ectopic pregnancy include amenorrhea. Also, nearby structure should be fullness or tenderness. Nausea, vomiting, and vaginal spotted may occur in ectopic pregnancy, but uterus does not enlarge because it remains empty. Weight gain may accompany ectopic pregnancy. However, fetal heart tone are not audible above the symphysis pubis in the client with this disorder. So in this picture, we can see the normal anatomy or structure of uterus. So we can see this is the ovary secrete ova, and then it is connected to the fallopian tube, and fallopian tube connected to the uterus, right? And this is the body of the uterus, fundus, and cervix. Next picture here, we can see if the fertilized ova get implanted in the interior of the uterus, we call normal pregnancy. But if the uterus is implanted any side except body of the uterus, we called ectopic pregnancies. So as I told you, ovary secrete ova and sperm come through the vagina, then body of the uterus, fallopian tube, and they united in the ampulla of fallopian tube. Then fertilized zygote supposed to be stay 3 days in the fallopian tube. Then they come inside the uterus. If the zygote implanted any part like body of the fundus, we call interstitial. If inside the tube, we call tubal, right? And it is inside the ampulla, tubal, inside the ovary, ovarian, even peritoneal, even abdominal, cervical. So this is the different site of ectopic pregnancies. So ectopic pregnancy, a condition where fertilized egg attached outside the uterus, and if untreated, it may lead to the life-threatening bleeding. So what are the symptoms of ectopic pregnancy? Patient present with abdominal pain, vaginal bleeding, delay menstruations, nausea, or appetite loss. If any mother have this, we diagnose of ectopic pregnancy is difficult and done by imaging test and blood test. So what are the treatment options? Embryo cannot be grow outside the uterus. If untreated, it is life-threatening condition to the mother and require immediate removal of the embryo through the medication or surgically removed. It depends on location and when detected. Next question here. A client who is 37 weeks pregnancy comes to the office for a prenatal visit. The nurse performs Leopold maneuver to assess the position of the fetus. After performing the maneuver, the nurse suspects that the physician will attempt external version. What did the nurse palpate the head of the fetus? So in this question, talking 37 weeks of pregnancy, prenatal visit, nurse perform Leopold maneuver. What is Leopold maneuver? We have to know. Assessment the position of the fetus. After performing Leopold maneuver, the nurse suspect what the physician will accept external version. And where did the nurse palpate the head of the fetus? The correct answer is head of the fetus should be this green areas. Geoffroid process close to. The rational said if the fetal head is palpated at the top of the uterus, the fetus is in buttock position or beach presentation or position. That is, the head is not to presenting part and physician may consider external version to convert the fetus to a cervix-like, vertex-like or head down positions. This maneuver is accomplished by applying the pressure on maternal abdomen to turn an infant over, right? So first of all, if you ask me, what is Leopold maneuver? So Leopold maneuver is named after the one of the physician. His name is Christian Leopold. He was gynecologist and obstetrician. So Leopold maneuver are the part of the physical examination of the pregnant woman. So you see picture 1, B, C, or any one you can follow. So there are 4 classical maneuvers are used to palpate the gravid uterus systematically. And this method of abdominal palpation is a low cost and easy to perform and non-invasive. A good doctor or very experienced RN can do this. So if we see the picture here, number 1, so first maneuver, the supine surface of the fetus is palpated to determine the consistency, shape, and mobilities. Second maneuver, we use both sides of the fetus are palpated. You see the both sides to determine the directions of fetal back is facing. And third maneuver, these steps determine the part of the fetus at the inlet and its mobilities. And fourth maneuver, these steps determine the fetal attitude and degree of fetal extension into the pelvis. Next question here. A nurse is caring for a 16 years old pregnant adolescent. The client is taking an iron supplement. What should this client drink to increase the absorption of iron? So nursing care plan for teen pregnancy is very important. So they said a glass of milk with a cup of hot tea with a liquid antacid with a glass of orange juice. The correct answer say with 1 glass of orange juice. So rationale said increasing vitamin C enhance the absorption of iron supplement. Definitely orange juice contain vitamin C. So taking iron supplement with milk, with tea, or any antacid reduce the absorption of iron, right? So when a 16 years old pregnant adolescents or teen pregnants come to us, we always try to promote optimal physical and emotional well-being of the client. We monitor the fetal well-being. We provide information and review the available options. Also, facilitate the positive adaptations to the new and changing the role. Also, encouraging the family or partner participate in problem solving. Very important for the teen pregnancy. Next question here, a nurse is assessing a developing a teaching plan for a client who's about to enter the 3rd trimester of pregnancy. The teaching plan should include identify of which danger sign that must be reported immediately. So when mother undergo to the procedure of pregnancy, they have some discomfort, and this discomfort is acceptable or normal, but some discomfort important to identify and notify to the healthcare provider because they are unusual, they are danger. Number 1, hemorrhoid. Number 2, blur of visions. Number 3, dyspnea or exhaustion. Also increase the vaginal mucus secretions. The correct answer is the blur of visions. So before to go rationale, I want to share with you what are the reportable danger signs every healthcare provider must know and must notify gynecologist or obstetrician. Number 1, if vaginal bleeding, abdominal pain, epigastric pain, visual disturbance or blur of visions. During the pregnancy, the blur visions may danger sign of eclampsia or pre-eclampsia. Complications that require immediate attention because they may cause severe maternal and fetal consequence. Although hemorrhoid may occur during the pregnancy, they do not require immediate attention. Dyspnea on exertions, increase the vaginal mucus are common discomfort caused by the physiologic change of pregnancies. What next? Severe, persistent headache. So mild headache is okay, but if it is severe and persist, 1st trimester, 2nd trimester, 3rd trimester, we have to notify. Change the fetal movement after quickening. change the fetal movement, painful or burning sensation of urine, edema on the face, feet, and hands, right? Also, a sudden rash or fluid, elevated temperature above the 101 means indicate infection, persistent vomiting after the first trimester. It can lead to the hypovolemic shock if untreated. Absence of the fetal movement after quickening. Next question, which instruction should a nurse give to a client who is 26 weeks pregnant and complication of constipations? So number one, encouraging her to increase her intake and also fiber containing food or drink at least 6 glasses of water per day. Number two, tell her to ask the caregiver for mild laxatives. Also, suggest the use of a non-over-the-counter stool softener. Number four, tell her to go to the evaluation until because constipation may cause contractions. So what are the best options? Encouraging her to increase intake of fluids and fiber containing food, and also at least 6 glasses of water. So always, as a healthcare provider, always we try to manage the patient non-pharmacological. If it is not work, go for pharmacological management. So rationale said the best instruction is to encouraging the client to increase her intake of high fiber foods. Also drink at least 6 glasses of water per day. Mild laxatives and stool softener may be needed, but dietary change should be tried first. Although starting during the defecations and diarrhea can stimulate the uterus contractions, telling the client to go to the elevations until does not address her concern. Next question here. Which document state that client have a right to confidentialities of medical record and a right to privacy, limited access to this information to the healthcare provider associated with their care? Number one, Health Insurance Portabilities and Accountability Act, shortly called HIPAA. So Health Insurance Portabilities and Accountability Act. So it is a federal law that is restrict the access to individuals' private medical informations. Second, living will. So living will, a written statement detailing a person's desire regarding their medical treatment in circumstance in which they are no longer able to express the informed consent, especially in advanced directives. So number three said healthcare power of attorney. So here it is important to know what is the healthcare power of attorney. So normally a power of attorney is a legal document that gives someone you choose that power of act in your place. In case you ever become mentally incapacitable. But what is medical power of attorney? So medical power of attorney is one type of healthcare directives, and that is a document that set out your wishes for the healthcare if you are not take that decision. So correct answer said Health Insurance Portability Act. So what are the rationale? So HIPAA is a law state that all healthcare workers must maintain privacy and confidentiality of the client records. So the primary role of standard address the use and also discourage of individuals' health information by the entire subject to the primary roles. So, as I told you, protect the health information. This is the main target or goals of HIPAA. So, a living will and healthcare provider are component of advanced directives. What is advanced directives? It is a written statement of a person's wishes regarding the medical treatments, often include the living will, or made to ensure those wishes are carried out should the persons be unable to communicate them to a doctors. Right? So advanced directives basically including the living wills. Again, let me recap it. Living will, also a written statement, details a person's desire regarding their medical treatment in the circumstance in which they are no longer able to express the informed consent. So American Nurse Association Code for Nurses provider the guideline for nursing actions in regard of the clients. So here are the few definitions, and one page contain all of the essential definition what every student must know for NCLEX board exam. Let me recap it. First of all, what is HIPAA? The Health Insurance Portabilities and Accountability Act. Protect the confidentialities of a patient's healthcare informations. It requires physicians, nurses, hospitals, and other healthcare providers to inform the client how their healthcare information is used and disclosed. Advanced directives include living will, durable power of attorney, also advanced care medical directives. So advanced directives are written instruction recognized under the state of law that are related to the provisions of care a person wishes to have when he or she cannot make the decision by themselves. So living will, prepared by a competent adult and gives the healthcare directives in the case when the person is unable to make decisions on their own. Durable power of attorney, sometimes called healthcare proxy, the documents that specify who will make your healthcare decisions if you contact. Advanced care medical directives is a competent client consult with the healthcare providers and specific the kind of medical care they do not do or they do not want in a specific scenarios. Next question here. A nurse is providing care for a pregnant client with a gestational diabetics. The client asks the nurse if her gestational diabetics will affect the birth. The nurse should know that, number one, labor may need to be induced early. The birth must be cesarean, C-section. Number three, mother will carry to term safety. And number four, it is too early to tell. So before to answer this question, every student should know what is gestational diabetes. Also, it is also called diabetics during the pregnancies. This is condition shows no or almost negligible symptoms in many women. Okay. So number for the correct answer said labor may need to be induced early, right? So rational said the early induction or early C-section or cesarean birth are possibilities if the mother has diabetics, also euglycemic, that have not been maintained during pregnancies. Cesarean birth is not always necessary, right? Keep it note. Sometimes if mother has gestational diabetics, they present with some sign and symptom like increase the thirstiness, frequency of urination, or excessive sweating, overweight, and fatigue. That is also common in diabetics patients, right? So if you ask me what are the cause of develop a gestational problem, obesity is one of the cause, or family history of diabetics, pregnancy over 30 years of age, or disturbs in some, function of insulin. So various factors might be responsible for this condition. Hormonal change during the pregnancy play a major role. Overweight before the pregnancy may also cause gestational diabetics. So how we prevent it? We prevent, have a balanced food or diet, eat healthy and nutritious food, add exercise, and also try to lose excess weight before pregnancy. So if any mother unfortunately have it, they have a chance to develop some complications. We categorized it maternal complication and fetal complications or fetal complications. So if uncontrolled, it may lead to the complications such as heavy birth or weight in the baby. So baby is supposed to be bigger than normal. We call macrosomia, or patient develop respiratory distress syndrome, hypoglycemic baby, polycythemia, hyperbilirubinemia, or congenital abnormalities like cardiac or neural tube defect. So low blood sugar in the baby or risks of future diabetic in the baby as well as the mother. And high blood sugar or preeclamptic mother also chance to develop this type of complications. Maternal chance to develop nephropathy, retinopathy, coronary artery disease, hyperglycemia, preeclampsia, or infections. Rational said early induction or early cesarean birth are possibilities if the mother has diabetes. So here few question answer we have done. I believe if you practice the questions in this series, it will help you to get your license, and we make sure we like to give you 100% guarantee to pass the NCLEX board. If you need any kind of more info, don't feel hesitate to contact with us. We are very happy to assist you.